Nurses at the Mahikeng Provincial Government Hospital are waiting this afternoon for their COVID-19 test results to come back. They were tested after a doctor tested positive for the virus. Reporter Pule Leshwiti is covering that story for us this afternoon. Pule, good afternoon to you. So the genesis of this, as I mentioned, a doctor working for 2 hospitals in the province testing positive for COVID-19. Obviously concerned as far as the nursing staff is concerned. At what point then do we expect the results to be disclosed?
Good afternoon, Jeremy. And what we do know is that currently some of the staff members here are being briefed, those who are specifically waiting for their results. And you're probably wondering where we're standing now. This is the maternity ward, one of the wards which are being decontaminated. And as you can see, electricians are now going inside just to try and see how they can try to get things into order. We're told that this ward will begin being cleaned, deep cleaned as well. But it was one of those that was affected. Out of 9 wards in this hospital, 3 of them were affected. It was the maternity ward, the gynae ward, and the theatre ward. On my far left-hand side, where these men are walking, is the labour section. And they're now trying to see as to how they can try to revive these facilities here and get things running again.
So as far as the nurses are concerned, they would be following normal protocol, I understand, and they would be self-isolating.
Yes, definitely, and that's the message we received here from the hospital. In fact, they're saying that they've taken a stance to ensure that those who are working and who are not in contact with the doctor follow strict precautionary measures. I just want to break down the numbers for you of how many people this doctor had been in contact with. And we received this, of course, from sources, and the Department of Health in this province has also confirmed that. So they say the contacts include 22 staff members, 2 doctors, and 21 patients at Victoria Private Hospital, as well as 104 patients at his private practice. And here at the Mahikeng Provincial Hospital, the doctor had been in contact with 12 doctors, 29 nurses, and 70 patients. That brings us to a tally of 281 people he had been in contact with. Quite concerning here as well, as the management at the hospital says they're taking the matter very seriously. Tracing systems have also been in place now to ensure that those who have been in contact with the doctor can now be can go into quarantine for 14 days or be further assisted.
There was concern earlier today. Staff at one of the hospitals were picketing over the reported slow response of decontamination in the areas in which that doctor had worked in. What do we know about that at this point?
Well, those are some of the concerns that have been taking place since last week, and nurses were saying that, things aren't being taken serious. Some of the allegations that are made is that they were made to work in the very same maternity ward which had now been decontaminated. But what we do know is that the hospital has come in to say that, by the way, they've come in and placed strict measures where these medical health professionals can adhere to. However, the union, how we say, is that that's the opposite message to what they're receiving. They are claiming that no proper measures were put in place in terms of prioritizing the safety of health workers at the hospital, and they're saying that they were exposed to these health hazardous conditions. And that's as far as much as it goes. In a couple of moments from now, we will know as to what's the mood in terms of nurses having received their results, and of course other medical health professionals here at this hospital.
Well, at the moment we have more information on that story. We will get back to you. Pule Leshwiti, thank you very much indeed.